So I want to show you guys how you can hopefully achieve neck pain relief right now at home. All you're going to need is a towel, not like a washcloth, it should have some length to it, and then actually 2 lacrosse balls. It could be tennis balls. I'm going to suggest lacrosse balls because I've had the best success with that. So with this one, you're going to be seated. When we roll up the towel, feel free to hit pause and come back if you want to. But what I'm going to do is really try to open up the lower neck. A lot of times our pain is kind of stemming actually from the lower base of the neck where we get too much mobility. So what we're going to try to do is help open that up and stretch it out a little bit. So you're going to sit up nice and tall. This is going to wrap around the upper base of the neck. You're going to pull it down as you breathe in and exhale. Again. Now I feel a really nice stretch with that through the base of the neck, and it kind of runs down my upper the middle back. That's exactly what we're looking for. We don't want pain with this. We don't want any sharp stabbing pain. And then from the side view, what I want you to see is that I'm not rounding. I'm keeping my chest up, okay? And the pull is down. It's not forwards, okay? So it's a... And one more. Now, I personally like a 3-second hold at the bottom. Shoot for somewhere between 10 to 15 repetitions to start to see if that's going to help provide that relief you're looking for. Beware, I've seen a lot of people that want to go the opposite way, that have provided education, that if you have neck pain, that you should actually be doing retractions. I just want you to know, I haven't had very much success with that at all. So I don't tend to do that because my clients haven't gotten better with that exact procedure. If you notice, I'm actually going the opposite direction. I'm trying to open things up, allow the nerves to get through there, get some more blood supply, and so that's been really helpful to my clients, and that's why I want to put it in this video for you. The problems I found are at the base of the neck. So what we're going to go into next, we're going to use our lacrosse balls, okay? So I'm going to go ahead and put lacrosse balls on the ground. I think you're going to get a better result if you do it on the ground versus the bed, because the bed's a little too soft. But what we're going to try to do is release the suboccipital muscles that sit on the back side of the base of the neck that cause a lot of people headaches and cause a lot of people neck pain. So I'm going to show you kind of a couple cool ways that we can release that with these two. I'm going to put them right here to get started, right on the base, okay? I'm going to keep them together, and I'm there, okay? So what I'm going to do, and it's a small movement, I'm going to move my head like I'm saying yes. Little chin nods. This is a very sensitive area in the suboccipitals. So all we want to do is just get a little bit of blood flow working and loosening up those areas. So it's just going to be yes, up and down. And it actually feels really nice. We almost all hold some level of stress there. And as you move your head into down like this, it's a nice way to open up where the tension's at in your suboccipitals. We carry a lot of nerve supply back there too, so it's a very neurally dense, sensitive area. So I would suggest that for a couple minutes, and then I'm going to put it on the back again, and I'm going to rotate side to side, and it feels really nice as well. We're working our C1, C2 joint where we predominantly do a lot of rotation. We get a lot of headaches and neck pain there too. So I'm going to put that right here. And I'm going to go side to side. Let's see if I can set that up. Okay, so I'm there. I'm going to bring my arms down just so you can see. And I'm going to go just a little bit side to side. Nice and easy. You might notice some clicking or cracking, which is okay. But keep that in mind should you go see a doctor where that noise is at. Now eventually, after you do it long enough, you're going to just need to reset it. So I'm going to reset. I'm going to keep them together. I'm going to reset, put them underneath the base of the neck, find where it's tightest, a little chin down, and then rotation. Okay? And I would do that for 2 minutes or so. The last one I want to show you is working our deep neck flexors, which is really important for neck stability, which can provide pain relief actually, believe it or not. The low back can get hypermobile and cause pain, so can the neck. So in the same position, I'm going to bring my chin just kind of towards my chest a little bit. And this might sound funny, but hang with me. You're going to put the tongue on the roof of your mouth. You're going to keep your lips together, but keep your teeth slightly apart. Believe it or not, that actually sets up your deep neck flexors like the longus colli and capitis for the best success. So I'm going to get here. I'm going to do all that. I'm going to lift and hold that for 3 seconds. Control it down each and every time, nice and slow. I can feel a little shaking there. The reality is, we don't work our necks all that often. And we need to. We need them to stabilize. And I would do that one for about 20 repetitions if you could do it. So anyways, we showed you how to stretch out the lower base of the neck. We showed you how to do really 2 self-massage techniques to your suboccipitals to help you move up and down and help you rotate your head a little bit easier. And then we kind of finalized it activating our deep neck flexors to help provide stability in the right places to provide you neck relief. I hope that helped. Thanks for hopping on. Take care.